Nicole. I'm one of the prenatal educators here at Sydney Adventist Hospital, and in this module we'll be talking about the pelvic floor muscles, what they are, where they are, and the impacts upon them for pregnancy and childbirth. So in the anatomy module, I discussed the pelvic floor as the group of muscles that line underneath the pelvis. So they're the group of muscles at the base of the pelvis. They attach at the front, the pubic bone, and they attach at the back at the tailbone. And they also attach side to side. So they're a large hammock-like structure underneath your pelvis. So just to rehash, there's 5 main roles of the pelvic floor. So that's to hold up the pelvic organs, so the bladder and the bowel and the uterus, to hold up those organs to make sure there's no slippage down. Also aiding to prevent the loss of urine with coughing, sneezing or laughing, which you may have heard as incontinence, so there can be stress or urge incontinence. It also has a role in preventing fecal incontinence, so fecal matter exiting where it shouldn't be exiting, and also a role with sexual function as well. So if we know the role of the pelvic floor, we need to understand how it's impacted on during pregnancy and childbirth, and then therefore why we need to re-strengthen afterwards. I just want to touch there for a moment and just say there's no difference in these pelvic floor muscles to thinking about a bicep muscle or a quadricep muscle and how we need to rehabilitate it and re-strengthen after childbirth. The only difference is it's an internal muscle, so you can't see it. So you need to try and be in tune with your body, and when we go to practice these muscles, and when we practice these exercises and when you go away and practice them, I want you to really think about the technique involved in activating these muscles and the feeling that you get when you activate. Because you can't see it, there's no other way of knowing if it's switched on. So I want you to take away that message, and we'll touch on that a little bit later when we talk about activating the pelvic floor. The main impact the pelvic floor has during pregnancy and postnatally is the weight of the baby for the 9 months. So there's a myth out there that if you have a cesarean section, that there's no risk of damage to your pelvic floor. That's actually untrue. It's actually the 9 months of carrying your baby on that hammock structure that can do the damage and the weakness of the pelvic floor. So that's something to consider as well, that the cesarean section actually does have an implication on your pelvic floor because you have also carried your baby for 9 months. There's also the weight component that you put on during pregnancy. So prior to pregnancy, you didn't have that extra load going down through your pelvic floor. So now you have the weight of your baby plus the additional weight that you've put on during pregnancy. You may have continued some exercises which may have been a little bit inappropriate for your pelvic floor. Some exercises which may have increased your intra-abdominal pressure and without you knowing has actually bared down and put more strain down on that pelvic floor. So instead of that resting trampoline structure being up here, it's now pulling down a little bit and not as supported. So those pelvic organs that I spoke about being supported up here, the bladder and the bowel and the uterus, has risk if the pelvic floor unit is not strong enough, there is risk down the track of prolapsing, which basically means those organs slipping down where they shouldn't be. Or, as I said to you, having the episodes of incontinence, whether that be urine or fecal matter. So the other risks, it could have been a coughing episode. You could have had bronchitis or asthma flared up during pregnancy, and that's extra load pushing down on that pelvic floor as well. During pregnancy, women often get constipated, and that bearing down when you're trying to open up your bowels can also be a contributing factor to weakness of your pelvic floor. So thinking about all that, thinking about the impacts of pelvic floor, we now know the roles of the pelvic floor, and therefore that leads to the reason why it's so important to re-strengthen in the postnatal period. You need to be practicing these exercises now during your pregnancy, and then as soon as after you've given birth. So literally day 1, day 2, you can start activating your pelvic floor muscles. You'll have the physios popping into your rooms and the midwives coming in and just checking that everything's okay, that you're not having any periods of incontinence. If you're having trouble actually being able to activate your pelvic floor muscles, then speak to one of the physios or the midwives and they'll be more than happy to talk you through it. I'll also refer you to the Choices in Childbirth booklet that also has some further information on your pelvic floor exercises. So start now during pregnancy. You need to get yourself into a quiet position somewhere in the house or somewhere in the car where you're not disturbed, because as I mentioned, you can't see these muscles being activated. You need to visually think about what is happening when you activate this and feel it. You actually need to feel that closure, which I'll describe to you in a moment. So somewhere in a nice quiet position. You can do it in the car. If you catch the train or a bus to work, no one needs to know you're doing these exercises, but you need to try and find a time of day where it becomes just part of your normal daily routine and doesn't become a chore. Because once you have had a baby, these exercises really need to be continued on daily, basically for the rest of your life. Okay, you need to make sure that those pelvic organs are kept up and everything is supported to prevent the prolapse happening and incontinence happening, as I discussed with the role of the pelvic floor. So to activate your pelvic floor, you need to be in a seated position, in a comfortable position. You need to think about what is happening. Now, if you're sitting, it gives you that feedback of actually lifting your vagina up away from a chair. You can get into a habit of doing them standing, brushing your teeth, or when you're in the kitchen, and that's fine. But when you're learning these exercises, you need to have that feedback from that sitting position. So what you need to think about doing is you need to think about drawing in the muscles, drawing in and up. So it's the muscles around your vagina, and you need to hold them without holding your breath. So you need to squeeze in and think about an elevator lifting up. That's the second component of the pelvic floor contraction. And you need to hold 2, 3, 4, 5, 6, 7, 8, and then you need to relax it out. You need to feel that complete relaxation down as well. So the pelvic floor not only needs to contract, but you actually need the relaxation component. Because when a head is trying to exit out through your pelvic outlet, as the baby comes down the pelvic outlet, guess what has to happen to the pelvic floor muscles to allow that head out of the birth canal? They need to relax out. So as much as you are contracting and practicing your contraction of the pelvic floor muscles, you also need to practice a complete relaxation of them as well. So you need to draw in and up and hold 2, 3, 4, 5, 6, 7, 8, and completely relax it out. You want to aim to do 8 to 10 repetitions of those exercises, twice to 3 times a day, if possible. So start practicing them now so you start to get the hang of it. Postnatally, you will have a little bit of swelling in that area, and you might not get that same sensation of them activating on, but just start slowly. And if you've been practicing them beforehand, it's not going to be as foreign to you. So start that process. The Continence Foundation of Australia is a great resource that I'll direct you to as well, a great section on pelvic floor. So I would invite you to go to that site, check it out, have a look at the video that they've got. They've got a great analogy on there on how to activate your pelvic floor. And if you get a little bit confused on how you should be activating your pelvic floor, it'll talk you through it step by step. So try and check that out as a little bit of extra help to activate. When you're here on the ward, there are daily classes run by the physios, so the pelvic floor exercise class. And on discharge home, pending COVID restrictions, there is postnatal exercise classes run on site. And that's also an ability for you to come out of the house, bring your baby with you, and actually spend 45 minutes of exercising for you. There's a component of pelvic floor as well as physical activity exercise just to get your postnatal strength back. So I would highly encourage you to get to both the ward classes and also the postnatal classes on site.